Well, good afternoon, and welcome to our weekly press conference about COVID-19, originating here from City Hall. I'm Larry Holsey, Director of Municipal Information and Communication for the city. I'll be the moderator for this, and I want to welcome you to our weekly press conference. We have a couple of special guests in addition to our regulars and some substitutes, but today we're going to follow the same procedure. And down in our studios in our first floor, we have an American Sign Language translation being inputted to the right-hand corner, as you see, of the image. And we also have an audio being recorded in Spanish in our studio that will lay over the video, and we'll be able to show that this afternoon at 4:30 to our Spanish-speaking audience, as well as it will be online. And always here, so gracious to invite those Spanish speakers in their native language is Hector Sabito, our Mayor Pro Tem. And Hector, if you will, please invite our Spanish speakers.
Absolutely. Good afternoon, everyone. Para ayudar a nuestros ciudadanos que hablan español a saber lo que se dice durante esta conferencia de prensa, un traductor está grabando una traducción en español en vivo durante esta conferencia de prensa. Esta grabación completa en español reemplazará el sonido del inglés en el video, y una versión en español de toda la conferencia de prensa se reproducirá en el canal de cable de la ciudad de Waco aproximadamente a las 4:30 de esta tarde. Puede ver la conferencia de prensa en el canal 10 o por internet en vivo en wccc.tv. Thank you so much, Larry, and thank you for the opportunity.
Thank you, sir, as always. Joining me again today, first of all, we're doing this all virtually as always. We just have two people in the room, myself and Julie Oliveira from the City Secretary's office, who's managing and running the Zoom meeting for us. But always so good to give their time and energy is our Mayor, Mayor Dylan Meek. We have online as well as that, we have County Judge Scott Felton. We have Dr. Jackson Griggs, CEO of the Family Health Center. Substituting for Brian Becker is Dr. Richard Haskett of Ascension Providence, and we also have Dr. Mark Lyson from Baylor Scott and White Hillcrest. Gentlemen, I thank you for that. We also have a special guest that I'm going to allow the mayor to introduce a little bit later on. We'll follow the same procedures kind of that we've done before, because today is a little bit special. We're really not going to have any questions, because I think the questions that have been submitted by the media, all of the participants have seen those and will be addressed those in their comments and in the presentations that we have. But we'll start off and have individual opening comments. First, we'll go with Dr. Griggs from Family Health Center, followed by Dr. Haskett, Ascension Providence, then Dr. Mark Lyson from Scott and White, and then Judge Felton, and followed by our Mayor Dylan Meek. Following their presentations and the special presentation, we will open it. We have 3 media representatives on the line that will be able to ask questions to. So let's get started with our opening comments. Dr. Jackson Griggs, CEO of Family Health Center. Dr. Griggs?
Thank you, Larry, and thank you again, Judge and Mayor. Start with worldwide numbers. There have been now 73,800,000 coronavirus cases to date, and 1,643,000 deaths due to COVID-19. And recently, the world has continued to set unhappy records week after week in terms of growth in cases and in death. The United States has seen a total of 16.8 million coronavirus cases and 305,000 deaths from COVID-19. The Johns Hopkins Center for Health Security also points out that although it appears that U.S. daily incidents may be beginning to plateau, we still may not have seen the effects from Thanksgiving travel and gatherings. That same group at Hopkins point out that if Thanksgiving holidays are to make a major impact on U.S. numbers, that evidence will be seen in the next week or two. Texas has seen 1,352,000 cases and 24,000 fatalities to date. And now I'll share McLennan County update as of this afternoon. The total number of confirmed cases in McLennan County to date is 16,818, and currently there are 1,038 active cases. As of yesterday afternoon, the Public Health District has received notification of 248 new cases of coronavirus. 119 people are currently hospitalized in Waco with COVID-19. 16 of those patients hospitalized with COVID-19 are requiring ventilator support. There's also one patient who has been hospitalized with the flu, which does signal some concern about the potential additional beds needed now that we're coming into flu season. It's worth pointing out that as we talk about masking and the imperative of masking to help keep the numbers down for COVID, it also has, at this point, the additional benefit of reducing the risk of flu transmission, which is just absolutely imperative right now. I'm sad to report that we have 2 additional deaths in McLennan County. We've now seen a total of 241 deaths to date in our county. In our community-wide surge testing, we have performed 39,014 total tests, and the positivity rate among that surge testing group is 10%. Within elder care facilities in McLennan County, there are 17 current facility outbreaks. There are 89 active cases among patients and staff in these facilities. And there have been 98 nursing home associated COVID-19 fatalities to date. At the county jail, there are 4 active cases. There's one church that has been identified with an outbreak, and the health district is supporting that church in investigation. There are 14 independent school districts and 4 private schools that are reporting cases on campuses. There's a total of 57 school campuses with active cases. And within schools, there are 178 active cases, which includes 81 students and 98 staff. So let me share now slides that include our incidents in our county as it compares with the state and the nation. So remember that this line graph represents new cases per day per 100,000 in population. So this is an incidence graph per 100,000 population. And this blue line is for the United States. And you see that the United States is now at 64 new cases per day per 100,000 population on a 7-day rolling average. Texas is here in orange, and you see the Texas new cases per day per 100,000 is 41. In McLennan County, you see a dip there when we had our Thanksgiving holidays, and then the kind of catching up from those cases that occurred that when we weren't testing as widely, and now we're at kind of 45 new cases per day per 100,000, which shows obviously a decline off of our peak, but still in a dangerously high level of new cases per day. As a reminder, where that falls in the strata that Harvard Global Health Institute uses, we're still beyond the tipping point, at risk for ongoing exponential spread. And while we're talking about the testing and the Thanksgiving holidays that passed, and now kind of coming down a little bit off of that peak, it's important to note that while the Texas positivity rate is 13%, our local positivity rate is 16%. Remember that the higher the positivity rate, the less we are catching all of the actual occurrences of the disease as it spreads. And remember, our targets are less than 10% positivity rate for mitigation or slowing of the spread, and less than 3% in terms of positivity rate for suppression of viral spread. Again, comparing populations, we can see current hospitalizations per 100,000. This is a snapshot in time. As of yesterday, what we see is in the United States, there are 34 individuals in the United States per 100,000, state of Texas, 32, currently hospitalized per 100,000, and in McLennan County, 45 individuals hospitalized per 100,000. That might cause the question to arise, well, why, if our incidence is less than the state, I'm sorry, if our incidence is less than the country, then why does the country have fewer hospitalizations? And right now, I think the take-home point is that we expect the United States hospitalizations to climb, and our hospitalizations, we're uncertain as to how that will relate to the United States. But the United States incidence is very, very high right now, and I do think that number in our national hospitalization rate is going to grow in the forthcoming weeks. This is a valuable slide provided from the health district that demonstrates the number of lab-confirmed COVID-19 patients admitted in our local hospitals. What you see here in the blue lines are the daily hospitalizations, the blue bar graph, and then the red line graph is the 7-day running average and of those hospitalizations. So what you can see here is that we are still at a very high rate of hospitalizations, over 100 patients admitted with COVID on a daily basis for the last several days. And again, with a high positivity rate, the fact that we're perhaps not catching all of the virus that's occurring and being spread in our community, we're concerned about the current level of high hospitalizations, particularly going into the Christmas holidays. And then finally, if we still have not seen the impact of the Thanksgiving holidays, which is something that the Hopkins group suggests, then we, in a kind of doomsday scenario, we could potentially see a surge in the next week to 2 weeks in hospitalizations caused by the Thanksgiving holidays, followed by potentially more spread during the Christmas holidays. So I think that we have to think about what the worst case scenario is, but certainly hope that perhaps we won't see the kind of sort of surge upon surge that we described earlier due to Thanksgiving holidays. I suppose there is some chance that we are far enough out from the holidays that that we may not see a major impact from the Thanksgiving holidays. I'm still not I'm still not fully exhaling. I'm still not really sort of at peace about that yet, though. So, in terms of numbers of fatalities by month, what you see here is that initial spike that happened in June and July. July, we really saw the mortality of the spike in incidents that occurred in June and July, and then while we did see some decrease in the numbers of deaths per month into August and September, we saw that number of deaths rise again in October, November. December, I would just make note that while that number is less than November, it's obviously lower because we're now just halfway through the month, and so we could potentially see as many as 70 or more deaths in December as we continue the days of the month. So that's a very much a concern. So the same slide that I've been showing, and of course the same rhetoric that we've been sharing for lots of months. So while it's not new information, it comes with a renewed sense of urgency and maybe even some degree of pleading. Please wear your mask over your nose and mouth whenever you're not with household members. Stay home as much as possible until this current surge subsides. Avoid drinking or dining inside a restaurant. Do patronize local restaurants, but carry your food out and bring it home. And remember to maintain 6 feet of distance from all non-household members. And that's all that I have. Thank you.
Thank you, Dr. Griggs. Let's go to Dr. Richard Haskett from Ascension Providence. Dr. Haskett.
Good afternoon, Larry, Mayor, Judge Felton and fellow panelists. My name is Rich Haskett, and I am the Chief Medical Officer of Ascension Medical Group here in Waco, also an obstetrician gynecologist and a native of Waco, and I'm very pleased to be here today on behalf of our network. I'll begin with we do definitely see the surge in cases at Providence. We have over 70 patients hospitalized in Providence Hospital. Incredibly high numbers. We are consistently running at or above our acute bed licensure. And this has been something that we have seen very consistently, and in some cases is growing. I would say that we are definitely within our early stages of what we could consider to be surge planning. Our medical staff are strong. Our nurses and care teams are vibrant, but they're also tiring. So to help with that, we have brought in 33 traveling nurses that are now working within our hospital to help give some relief to our care teams. And we have also requested through the STAR program 15 intensive care unit nurses, 15 med-surg nurses, 9 respiratory therapists, and additional lab and phlebotomy staff, in the hopes that we can give our care teams a little bit of break, help them to renew and refresh as best they can over the course of this holiday season. We are planning on beginning vaccination of our employees. We will stay consistent within national and organizational Texas guidelines as we begin that. Happy to answer more questions about that later. We expect to start that process Saturday.
Okay, thank you very much, Dr. Haskett. Let's move to Dr. Mark Elyson from Baylor Scott & White Hillcrest. Dr. Elyson?
Yes, and again, thank you for having me. Glad to be here and to participate. This is an excellent forum for disseminating important information and some statistics and general advice. So today, just wanted to kind of also comment on the status of Hillcrest with Baylor Scott & White here in Waco. So also, along with Ascension Providence, we are seeing high numbers. We're seeing a lot of regular traffic, regular types of illnesses, but we're also dealing with a lot of COVID patients. And as we've said before, what's troubling and distressing about this illness is that it is largely preventable. And as we confront this illness, we want to limit its spread. And so, again, we will continue to encourage people to wear masks as instructed by the governor, but also to use hand hygiene and to social distance. This week, we saw more deaths in McLennan County, and so that takes us up, as Dr. Griggs said, to 241 deaths in the county. And that takes us up to over 300,000 deaths in the United States. And that means more than one American is dying every minute from COVID. And we saw a statistic this week that as we crested that 300,000 mark, that is actually more than we had in combat deaths during World War II. And this is a war, one that we're going to win. And adding to our arsenal this week is the vaccine. A lot of people are excited, and some people are also very hesitant and concerned. And so we're going to answer a lot of those questions today and get you some good information about the vaccine. But this is what people were asking for from the very beginning. People were asking for a vaccine, and people were asking for herd immunity. Herd immunity happens as the population at large is vaccinated, whether that means by having the disease or taking the vaccine to prevent the disease. This vaccine has been tested and is shown to be safe. And so we'll again get into some of those details and try to persuade you, but ultimately it is your decision to participate or not to participate. But the vaccine is an answer to many prayers and many requests, and the scientific community has stepped up and delivered. So we're excited about that, that tool that we're going to add to our toolkit this week. Thank you.
Thank you, Dr. Elyson. All right, let's go to McLennan County Judge Scott Felton. Judge?
Good afternoon. Well, I too am very excited about the vaccine actually coming into the state and into the city. I'm looking forward to hearing more information here in a little bit on the vaccine. I think in the meantime, with the Christmas holidays coming up, it is a time that we traditionally gather and see old friends and family And so it's going to pose another challenge to our numbers if we don't heed all the warnings that have been put out there by the medical community. Then we've just heard from Dr. Griggs and Dr. Lyson on things that you can do to prevent it. I would remind you that testing can be used as a strategy. We have employed that strategy along with contact tracing in the county for our employees as well as the inmates at the jail. We encourage our employees to get tested, and if they came back positive, then we had our HR division to help supplement the efforts of contact tracing to try to prevent those people that, especially those that are asymptomatic, really don't know that they could spread it, to try to protect their family and people that they work with. And we've done a lot of things as well within the offices to protect people using plexiglass shields and those things as well, and then masks, of course, everywhere. And we are starting a testing regimen at the jail with some new testing kits that we have. And, it's important that we control that. So I look forward to hearing about the vaccines, and I've been getting a lot of questions, and I've told everybody to tune in today because the new information will come out here that I'm sure you'll learn something that you didn't know before. So thank you for having me.
Thank you, Judge. Waco Mayor Dylan Meek. Dylan?
Good afternoon, everybody. Once again, I want to thank everyone for participating in this call, Judge, and our doctors from our local health systems. We appreciate your time. I want to be really brief in my opening remarks today because I'm excited to get to Stephanie's presentation here in a moment. The first thing I want to do is just reiterate what we've already heard from our local doctors, our local trusted doctors here in Waco who are giving us good advice on safe protocol. I appreciate that safe protocol and want to just emphasize the importance of that. The next thing I want to do is focus on the policymaking authority that we have here locally. I know this is a reminder, but just as a reminder here locally, we have no policymaking authority at the local level. Governor Abbott has issued an order restricting us locally from implementing any orders. He has complete control over everything from business closures to occupancy to mask mandates. We have not gotten any word of any deviation from the current system at this time. And so what has been the case looks to be what will remain the case. On the note of hospitalizations, as we see our hospitalization rate rise and hear information like we did from Dr. Haskett that Ascension Providence is entering into the beginning stages of their surge plan, I think it's important for the community to know that our local government, our health district, our county, our city are all in frequent communication with our local hospitals to ensure that we're working collaboratively and strategically to make sure that Wacoans will be able to access critical care that they need at any point. And at this time, I feel very confident that that is going to continue to be the case. Again, this is a time for hope. We're about to talk about vaccinations. Stephanie Alvey is the preparedness coordinator for the Waco McLennan County Public Health District, and she's going to give us a presentation on that. And then again, if any of the doctors on the call want to jump in and contribute from a medical perspective, I'm sure that will be helpful as well. So with that, I'll turn it over to you, Stephanie.
Thank you, Mayor. Good afternoon, and thank you, Mayor and Judge and everyone else for having me today and giving me the opportunity to provide some information on what we know about the vaccine rollout and what we're doing to plan for the availability of the vaccine in our community. As the Mayor mentioned, my name is Stephanie Alvey, and I am the preparedness coordinator here at the Waco McLennan County Public Health District. And I'm really here today representing all the people and the programs that have really been working on these kinds of plans for many, many years. So today I just have a couple of slides that I want to present to help give you a visual of what our planning process looks like. Let me get my screen going here. Okay, And so to start, I just want to provide a little information about the timeline that we're working under. In order to most effectively plan for the rollout of the vaccine, we have been working under this timeline that has been established by the CDC and federal officials with Operation Warp Speed and DSHS. And this is a very fluid situation, so these dates can definitely change. As you can see, we have been in what we call phase 0 up until this last weekend. The first emergency use authorization for a vaccine was approved last Friday, and the Advisory Committee on Immunizations Practices released its formal recommendations on Saturday, formalizing the recommendations for the use of the vaccine and establishing the first primary group to receive the vaccine as healthcare workers and residents of long-term care facilities and nursing homes. And so as of this week, we are entering phase 1A, and we expect to be in the phase until January, when we expect to get a little more guidance from the Advisory Committee on Immunizations Practices and the Department of State Health Services about who will be included in the phase 1B group. In all of phase 1, we do expect that the vaccine supply will be somewhat limited, but as we move into early spring and summer of next year, the vaccine supply is expected to increase, and we'll be able to offer the vaccine to those with pre-existing medical conditions that make them more susceptible to severe disease. And by late summer and the end of next year, we expect supply to be sufficient enough to vaccinate anyone in the general public that wants to be vaccinated. Again, this is a very tentative timeline, and the specifics of who exactly will be included in each of these phases will be released by that Advisory Committee on Immunizations Practices and the Department of State Health Services as we move into those phases. And I know that we've also been getting a lot of questions about who will get the vaccine first and when will I be able to get vaccine. And so this slide just shows a list of all of the groups and individuals that have been identified by the CDC and the Advisory Committee on Immunizations Practices as critical populations that should be considered to receive the vaccine first, while the vaccine supply is still really limited. But beyond the healthcare personnel and the long-term care facility residents, we have not received specific guidance on definitions for who falls exactly into all of these other categories just yet. So as I mentioned, the availability of the vaccine is being released in phases. And to start, we are looking at healthcare workers in the long-term care facilities as part of phase 1A. With the healthcare workers, we have received a very specific list of types of providers that fit into that definition. And the categories even been broken down into 2 tiers to further prioritize who should have access first. And obviously those working most directly with the sickest COVID-19 patients, which are our hospital personnel, were the top priority, which is why they've seen the initial allocations going to the hospitals. But also included in phase 1A are EMS providers, funeral directors, and those healthcare staff working in the outpatient and home health type settings. And so vaccine providers are required to focus on these populations first. And those are really the only 2 slides I had. So let me. And so another big question people have is, where can I get the vaccine? DSHS, the Department of State Health Services, is responsible for making the allocations of vaccine to vaccine providers at the local level. And those vaccine providers had to enroll specifically for the COVID-19 vaccine program. Some of those providers are the ones that we traditionally know to be vaccine providers like doctors' offices and clinics and pharmacies. But for the COVID-19 vaccine, we're seeing some other more non-traditional types of sites like the jails and the juvenile detention centers. And dialysis centers and our long-term care facilities. And when these providers enrolled to start with, they had to sign an agreement with the CDC saying that they will follow those guidelines set forth by to follow those priority groups. So at the local level, we really have no say in who falls into those priority groups. We can just help work with the providers to implement the guidelines set forth and help connect those people that fall into those priority groups with the vaccine providers as they become available. And now to give you a little bit of an idea of what the vaccine landscape looks like, we do know that there are several vaccines in clinical trials, and there are multiple manufacturers as well as multiple types of vaccines in the pipeline. There are currently 2 vaccine candidates that are the ones that are going to be available to healthcare workers starting this week and through the end of the year and early next year. And the first is the Pfizer vaccine, of course, which everyone is familiar with. And the second one is expected to be from a manufacturer called Moderna. And both of these vaccines are similar in that they use the same platform, the mRNA platform, and they both require 2 doses of the vaccine to provide the best protection. And both vaccines are expected to be approximately 95% effective. The guidelines released this week say that the Pfizer vaccine is suitable for individuals 16 years of age and older, while the initial Moderna vaccine trials only included people 18 years old and up. And they both require a 3 to 4 week wait time between the 2 vaccine doses, and they both have some significant cold temperature requirements. The Pfizer vaccine is the one that requires the ultra cold temperatures of -70 degrees. And as previously mentioned, the Pfizer vaccine did receive its emergency use authorization last week, and the Moderna vaccine is being reviewed this week. So we will be getting many more details about the vaccine in the coming days as well. And there are several other vaccine candidates that are still in phase 3 trials, and we will likely see data from those trials released in the next few weeks to months. And so what we're doing locally to plan for the rollout of these vaccines, I'll just touch on a few broad strategies that we've developed. But first off, I will say that we have been planning for what we call medical countermeasures distribution, which includes vaccines, for many, many years. Actually, in 2002, one of the first priorities of my program here at the health department was to plan for the mass distribution of the smallpox vaccine back when we were worried about the bioterrorism threat. So we do have plans in place to address the large-scale vaccination, and we have practiced those plans through large flu vaccine clinics and drive-through clinics over the years. Of course, this vaccine and this pandemic create some special challenges that we are working to address. And so one of the first strategies that we have started on is forming the COVID-19 Vaccine Planning Coalition. With the information on vaccines evolving and changing almost daily, it was really important to us that we pulled together all the stakeholders that have a role to play in getting the vaccine out to the public, pull those stakeholders together and share information and expectations. So we started meeting with that group a couple of weeks ago, and we really have a good representation of different community partners that provide a broad perspective for planning of this rollout. Second, we really wanted to promote awareness and provide education on the efficacy and safety of the vaccine. We know that we're going to be having to combat a ton of misinformation. Education and transparency is going to be key, which is part of why I'm here today, so that everyone knows what our plans and expectations are. And we do expect a lot of hesitancy in the community. And so we are working to understand what is causing that hesitancy and how we can better address those concerns. And third, we want to identify and address the logistical needs of the vaccine distribution. And as I mentioned, we have planned for this, but we know that there are some special logistical challenges with these vaccines. And again, we are not actually distributing the vaccine locally, as in the city, county, or the health department aren't receiving it and distributing it out to the providers. This is happening through pre-established channels for ordering and allocation at the state level, and will be shipped using their normal vaccine allocation channels and delivery methods. But we want to make sure that the local vaccine providers have the tools that they need to receive, store, handle, and administer the vaccine effectively. And we want to be here to provide that technical assistance as needed. Fourth, and we will continue to plan for how we will make this vaccine available to the public on a mass scale and how that will look specifically with this vaccine. We definitely want to focus on making the vaccine accessible and available to all residents that want the vaccine. And as I mentioned, we have formed a coalition that includes broad participation from many of our community partners, and we will work through the coalition to identify ways to ensure that the vaccine is made available to our residents in a just and equitable manner. And that really concludes my part of the presentation today. I hope it provided some clear and helpful information on what we expect for the availability of the vaccine in our community. And thank you again, Mayor and Judge, and I'm happy to answer any questions.
Thank you, Stephanie. And at this point, I'll just ask if Dr. Griggs, Dr. Eliason, or Dr. Haskett have anything that they'd like to add on this subject matter. No pressure.
Well, I'm happy to share a little bit about what a messenger RNA vaccine is, because it's a new type of vaccine, and there may be some concerns. I might be able to demythologize it to some degree. Let me start, though, by just pointing out that vaccines prevent many millions of diseases each year across the world and in our country. Over the past 20 years, it's prevented almost 1 million deaths in children, an untold number of instances of deafness, blindness, stroke, and all kinds of reasons for hospitalization. And so there's a sort of complacency, and maybe there's room for mythologies to grow up when in a community when we aren't seeing the same kind of things that we saw in the 40s, 50s, and 60s, when people were so much sicker from diseases that have now been largely eradicated. And so it's in that kind of context that we approach some of the myths that have grown up about this particular vaccine. Both the Pfizer and the Moderna COVID vaccines are injections that contain messenger RNA in a lipid molecule. So imagine a little fat droplet that's surrounding a tiny bit of genetic material. That fat droplet or that lipid molecule allows the messenger RNA, that little recipe, that little bit of genetic material to enter into the cell. It's important to know these are what's called non-infectious, non-integrating vaccines. There's no potential risk of infection, and the non-integrating part of that definition suggests that there's absolutely no potential risk for something called insertional mutagenesis. That's a fancy medical word, insertional mutagenesis. That means that the messenger RNA can't enter into the human cell's nucleus and tamper with our genetic material. And the idea of a vaccine carrying a little bit of genetic material might sound alarming, but it's important to sort of separate science fiction from actual science. I love science fiction, and you know, these days movies about mutations in genetics and everything else are fun, but it's sort of orienting to know that every time you get a cold, there's actually a virus that's injecting genetic material into our cells. So this is not something that's new or science fiction. This is something that we learned from the way that nature actually works. Unlike viruses, though, this genetic material never enters into our own cellular blueprint vault. So it never gets into the cell nucleus where we hold our genetic code. It's a short-lived, tiny little span of genetic material that enters into the cell. It hops on to our protein-making machinery called ribosomes, and it makes the S protein, the spike protein, on the ribosome. That little bit of genetic material then gets destroyed, and by the usual cellular mechanisms, it just dissolves. And that spike protein migrates out to the outside of the cell, where antibodies are formed when our immune system recognizes that little bit of protein as foreign. So our body goes, there's something that doesn't belong on the outside of that cell, must be foreign, let's get rid of it. Antibodies are created, and then those and that immunity then is memorized by our body, so that when we're later exposed to the actual COVID virus, those antibodies can attack that virus, render it ineffective at multiplying, and keep us safe from all of the potential consequences of COVID-19. So in terms of the safety of this virus, thousands of people have been given the virus, and the side effect profile looks like other vaccines. Of course, there's always a risk for a serious reaction like an allergic response to it, but those are just so exceedingly rare. And just like every intervention, just like riding on I-35 in your car, there's a risk-benefit analysis that we have to do. What's the benefit of the intervention? What's the risk of the intervention? And how does that fall? Obviously, there's risks getting in your car and driving to HEB or driving to Austin, but the benefit usually far outweighs the risks. And in this case, the same holds true. There's more specific guidance that's coming on to the covidwaco.com website. I think some preliminary information has already been posted there, but check in there on a regular basis. Several of us are involved in that information, getting that information out. So it's a good place to check periodically. And again, Stephanie, just as I've said offline, I'll say publicly, your public health leadership around the vaccine has just been outstanding, and we all feel a debt of gratitude to you for that excellent work.
Thank you.
Thank you to everyone. Larry, I think that'll complete the presentation, and we can now go to the media questions.
Okay, we do have 3 media representatives online right now. We have Drake Lawson from KWTX, we have Rihanna Sagert from the Waco Tribune Herald, and we have Shaquille Amari from Fox 44. So we'll go in that order. Drake, if you'll unmute your mic and ask us your first question.
Yeah, Larry, can you hear me okay?
Doing fine. Go for it. Yeah.
Okay, I had a quick question regarding the vaccine and once people do get the vaccine. And I think it's been mentioned before, but I've just heard so many people mention this to me just out in public. Once you get the vaccine, does that mean that I can just throw the mask away? Does that mean that I can just go back to hugging people and, I'm free of COVID? Or do people still need to do social distancing and wear their mask even after they get both doses of the vaccine?
I think one of the doctors on the call is going to be best suited to respond to this. Anybody want to field it? Dr. Eliason?
Yeah. So first of all, it might take several weeks for the...
Dr. Eliason, your microphone seems to be funny, or other people doing that as well.
Can you hear me now?
No, it's acting up. Sorry about that. It's a smart way to get out of answering a question.
Now.
Still fuzzy. Dr. Griggs, you want to field this one? Sorry, Dr. Eliason.
Yes, but Rich Haskett may want to answer. I feel like I've talked a lot. Dr. Haskett, do you want to?
Oh, no, I'm fine too, Jackson. Oh goodness, my mic's out too, huh? Or can y'all hear me?
We can hear you, Dr.
Okay, I'm getting a little bit of abnormal feedback on this end. So I would say that until the herd immunity level is reached, we probably need to be careful as much as we want to take those masks and not have to wear them. There has been a little bit of lack of clarity about the immunologic impact upon IgA, which specifically gives you your immunity and your mucus membranes. And so that
which one?
Go to the Polycom. That's probably the best one.
Which one?
That one right there.
That one?
essentially pass it on in a asymptomatic fashion. So yes, I'm ready to get rid of the mask too, but we're going to be careful after the vaccination until some of those issues are clarified. I'm hopeful that we'll be able to be at that tipping point maybe in about 6 months or so is my hope.
That's very consistent with what I've heard. So I think we're on the same page there. I think the immunity is first demonstrated a week after the second dose. So for the Pfizer vaccine, first dose, then 3 weeks, then second dose, another week, we see immunity. But remember that herd immunity is what we're looking for. And until we see herd immunity in our community, we'll need to continue to wear masks and our social distance, which is, yeah, I agree, Dr. Haskett, it's going to be months and months now. So.
Okay. All right, let's, Drake, if you'll stay on the line, we'll come back to you in just a moment. Let's go ahead and go on to Rihanna Sagert from Waco Tribune Herald. Do you have a question? There you go. Rihanna, are you there?
Yes, thank you.
Okay.
What medications are prescribed to outpatient COVID-19 patients? It's just something that I've never asked during one of these.
Another question for one of the doctors, Dr. Haskett or Dr. Eliason, do y'all know? Do you have an answer to that? Not working. Sorry about that. Dr. Griggs or Dr. Haskett, do y'all know? Do you have an answer?
I think the family medicine doctor should answer that one, Jackson.
Well, the only medication that I know that has evidence around preventing the progression of COVID-19 to more serious disease is the monoclonal bamlanivimab that we've discussed before in the press conference, that given early to high-risk patients who have symptoms may decrease progression to serious disease and death. And I wish Dr. Eliason was on so that he could add, because I know this is an area where he has some expertise that I don't have.
Okay.
Thank you.
Still not there, Dr. Eliason. You might try going out and coming right back in. I don't know completely. That might be the only way to solve. If you wanted to back out, we'll let you back in again, and we'll try that. So let's go ahead and stay on the line, of course, Rihanna, for the next one. Shaquille Amari from Fox 44. Shaquille, are you on the line?
Yes, I am. Okay. So Fort Hood got their COVID-19 shipments today. Baylor Scott and White in Temple was yesterday, I believe. So what about McLennan County? When can we see shipments here?
Stephanie or Kelly, do y'all know that?
If the hospitals have more current information than me, but I know that they had released a list of providers that were receiving it yesterday and today, and neither of our facilities were on that list. So there are a total of 110 different facilities receiving vaccine across the state, and that's expected to happen over the next few days. Last we checked in our system, neither of the facilities had received their allocation just yet.
Dr. Eliason, the question is, are you familiar when your system will be receiving vaccinations as a provider?
Yeah, so it's already in play. So some providers are already receiving vaccines today, vaccinations, and that will continue for several weeks to come. It's a matter of just getting people in line to get it done.
And the specific question was about McLennan County. Do you have any updates on that from your end?
Yeah, so at Baylor Scott and White Hillcrest, we anticipate that starting on Friday.
Thank you, sir. And your audio is working great.
Yeah, so can I go back to Drake's question? I just had a couple additional comments, if I could.
Yeah, please.
So anytime someone receives the vaccine, it's important to keep in mind that those antibodies, which are protective, aren't really going to start gearing up until about 2 weeks into it. So even if you've gotten the vaccine, the theoretical risk still remains for at least 2 weeks. And then it's also important to remember that even if you get the vaccine, and even if you do have antibodies, the study showed with Pfizer's vaccine that only 90% of people maintained protection. So in theory, there's a 10% risk. I got the vaccine, I could still get the illness. And although you may not come down with the illness, you may still have the virus in your body, and you could still be contagious for a couple of days as your immune system is dealing with that virus. So you may not get sick, but you could still be a carrier. And then lastly, I would also say that until the governor tells us to remove the masks, we have to wear the masks.
Okay, very good. Okay, Shaquille, stay on the line. We'll come back to you in a minute. Drake Lawson, we're going to go back to you again for a second question. Do you have a question for us again?
Yes, just regarding the vaccines that have been delivered to the hospitals and the ones that are going to be coming to Hillcrest and Ascension. Regarding that 2-dose vaccine plan, I don't know if Dr. Haskett or Dr. Eliason, if you guys know this answer, but is it going to be one of those things where they just, the people who initially get the vaccine, they'll come back in 3 weeks and they'll easily be able to get the second dose of that vaccine? How exactly is that going to work as far as, since it is a 2-dose vaccine?
Yeah, I will say for us, it's been a lot of operational work. First, to identify a fair, equitable an appropriate way of giving the doses in the first place, because at least from my understanding, we didn't have enough vaccinations to get everybody vaccinated that meets the complete entirety of that 1A classification. So we had to do a lot more work to make sure that we were taking care of the people that do the work. And that's not just the doctors and the nurses. I mean, that's nursing assistants, it's respiratory technicians, it's housekeeping, it's food services. I mean, when you come into a hospital, it's an entire system of people that are there to take care of you. And everybody that's in our highest risk locations had to be vaccinated. So it's been a logistical challenge. First, as we're trying to react and acknowledge the regulatory evolution as it occurs literally in a day-by-day moment. But I feel secure that we have a good system that we can count on to not only get the first round done accurately, but get the second round done in an accurate and timely fashion.
Yeah, same for Baylor Scott and White Hillcrest. It's a matter of identifying who are the frontline workers, which doesn't just mean doctors and nurses, as Dr. Haskett eloquently stated. We're identifying those people who are in contact, and then finding those who want the vaccine. And there are a few people who don't want the vaccine for various reasons, and then giving it to them. And then, yes, they are to return in 21 days to get their second shot, the booster shot. And we're going to keep track of who those people are so we can get that, make sure that that's completed.
Okay. Rhiannon Sagert from the Waco Trib, do you have another question?
Yes, for Judge Felton, has the jail requested vaccines or to be a direct provider, or will the jail contract with somebody to provide vaccines? How will it most likely be handled?
Well, we will, in fact, I was going to call Stephanie after this call to set up time to talk to our law enforcement folks that include the jail management and those to figure out how we're going to roll that out. But of course, the jailers are the ones that are more apt to bring it into the jail, because the inmates don't come and go; they stay. So we have to be careful. We protect that group of people out there that's well over 1,000 folks that I would manage that. So Stephanie, I'll be calling you on that. Thank you, Rihanna.
Stephanie, do you have anything that you'd add to that question?
I will just say that the jail has enrolled to be a provider. Of course, we don't know exactly when they'll get an allocation or exactly how they'll have to prioritize their staff once they do get that vaccine, but they have enrolled as a provider so far.
Okay, back to Shaquille Amari from Fox 44. Shaquille, are you there? And do you want another question?
Yes, I am. So I have a two-part question. Basically, yesterday I did a story on Midway ISD sending a petition to the governor asking to be one of the first priority to get the vaccine first. I wanted to know what you guys think about that. And also for the doctors, what's the difference between the first shot and the second shot?
Any of the doctors want to field the question on the first shot versus the second shot?
You know, I'm supportive of Midway ISD looking to get out ahead and getting vaccines for particularly for their teachers and staff. I think the EUA for the Pfizer vaccine starts at 16 years old or older. Stephanie, just shake your head no if I'm wrong on that. 16 years old and older. So I suspect that is the focus of those vaccinations will be on teachers and not students. And if I recall, again, Stephanie, you can help clarify if I'm saying this incorrectly, but teachers are in phase 1, is that right? Educators are in phase 1B, is that right?
Yes, I believe that's correct. We don't have specific guidance for sure confirming that, but that is what we have been told at this point.
So if they're getting out ahead of the group, you know, then it's not by far I mean, in terms of ahead of other features, it's not going to be by far because they're a prioritized group. And the second part of the question was
so the difference between the second and the first doses. You want me to get that?
Yeah, go ahead.
So it's not a different medicine, it's not a different vaccine, it's just more of the same. So just like the polio vaccine or the hepatitis vaccine and so many other vaccines, our immune system needs a reminder. And so it's just a matter of priming the immune system, exposing it to the opponent, basically, the threat, and then reminding it later, hey, we were for real. We really want you to remember this pathogen so that when you see it again, you have sufficient memory and antibodies ready to do battle. And so it's kind of geared up.
If I could add one thing, I think the only difference is going to be maybe a little bit more side effects with the second vaccination. I'm sitting here looking at the Pfizer handout, a little bit more fatigue, a little bit more incidence of a headache. These are just small differences. Mild increases in the amounts of chills and muscle and joint pain. The thing to remember is this is not altogether different from the tetanus vaccination that I got as a kid. And I think what we're at risk of forgetting is what my grandmother's life was like, who was married 100 years ago. She would have known people who had tetanus. She would have known people that had diphtheria, whooping cough, smallpox, mumps, measles. Her life and the lives of others around her would have been filled with stories of people that were killed by these diseases. A memory that we don't need to share with COVID any more than we already are. Vaccination is going to help us get there.
Thank you, doctors. All right, Larry.
Okay, well, I'm going to turn it back to you, Mayor, because that completes our visit with the three media. We appreciate them being on the line to ask questions. That maybe didn't get covered by all the pre-comments, but if you will, wrap us up.
It's great. Thank you so much for the time, to our doctors on the call, as well as Judge Felton and Stephanie and Kelly Crane for being with us today. We so appreciate your time. I think there's a lot of good information that was shared today that is hopefully going to be helpful to our community, that can empower them with this information. And again, if there's a subject matter that we're going to cover while discussing COVID, it's certainly nice that we're talking about vaccines in a brighter future in the days ahead. So thank you for the science-based conversations that the doctors provided, as well as the hard work that our community is doing together in collaboration to make sure that we're prepared for the distribution of these vaccines on a practical level. Again, continue to be safe, and we will see you soon. Thank you.
Thank you very much. Thanks to all the panel. And I want to remind everybody that additional information is regularly updated on our covidwaco.com website. So go there anytime if you're in question. There's all types of resources there to follow up on. And we remind you that we will have the Spanish translation today at 4:30 on our channel, as well as this will also be on our website in English. If people who've not been able to see it, they were at work or whatever, you can share this information. Great information, and then we want to get that out there. Cannot remind enough to get the flu shot, because you've heard the sad situation that we have one case in the hospital right now with the flu. We want to prevent the flu from impacting the COVID-19 treatment and the hospitalization rate, which we don't want to continue to be the way it is. We want to get down to that trauma level M below 15%, where we can get back to 75% or whatever. We know this formula. We've talked about it. Now, again, that information is on the covidwaco.com website too. So that's all that information we have. We hope you've learned from this. Be patient, be safe. Christmas is coming up. Think about how you're going to treat that and celebrate with your family, but do it in a safe way. And thank you for joining us. Have a good afternoon. All right, we're clear.